I'll get it. I'll get it.
Go, Miriam. Go.
Run, Miriam, run.
Come on, run.
Run like James.
Thank you.
I'm older than you too. Yeah, that was not bad.
James Scott had a medal at the 5K in San Diego.
Yeah.
So
And
he has practice.
I even stopped at the restroom for 5 minutes during the run.
TMI.
I think I was the only one in my age group. So our next speaker is an Enrolled ambassador. Her and her husband Scott live in Windsor, Colorado, with 3 beautiful children. She loves the home-based business industry because of the freedom and the family time it allows.
I forgot.
Keep going.
You're going.
Keep talking.
And she has a passion for showing us and helping us to use our longevity business to enhance. Okay, what's going on?
I don't know.
What'd you do?
I didn't do it.
Marianne did it. Anyway, I would like to have you have a warm round of applause for Juliette Fardulis.
Thank you for the welcome. There's a reverberating echo, isn't there?
Is it echoing?
We didn't used to have that with the other speakers.
You guys messed it up. I don't know what to do.
Is
Hold
it
on.
still kind of weird?
Hang-
How about online? Is it too echoey? Are you okay?
Where's
Give
the
us a
other
thumbs up
microphone?
if we're okay.
Maybe.
We might have to mute that
maybe
one.
it's other- yeah.
Mute that one. Or turn it off.
Is that better? We are professional technical gurus. Just watch alert.
James, you can mute it back there.
Okay, is that better? That's much. Okay, well, I am, of course, always in love with everything longevity, and I love it when they bring in something new. And the reason I love them to bring in something new is because it gives you another reason to be able to go and talk to your friends and your contacts, and even someone who maybe has said, no, we're not right now, to some other thing that you introduced, whether it was product or the opportunity. So when we have something new to talk about, it gives you a whole new reason to reapproach them. And so that's something new that I'm really jazzed up about, and so is Scott. It enhances everything that we have with Dr. Wallach, and our opportunity that we have with longevity is the healthcare plans. So I want to demystify the healthcare plans, because if you're not familiar with them and you would like to learn more, I'd like to just simplify it. How does that sound? Okay, good. You got some thumbs up? All right. So you can go to your own healthcare website that you have right now. Everyone has it. You can write it down if you're not sure what it is, but all it is dachealthcare.com / your ID number or your username, whichever you prefer to use. So dachealthcare.com / your ID number or your username. And if you go there, you can read, download, learn everything about the plan. And at first it might look like Greek, because most of us are not insurance professionals. Autumn is. She's an insurance agent. Are you excited about these healthcare plans? Yes. She's very excited. Her eyes have been opened. And Robert is as well. He's a professional. So We also have Kent Huff, who wanted to be here, but he couldn't make it, and Evergreen, and he is a financial planner and also an insurance advisor for life insurance and different types. And he is extremely excited to be able to offer healthcare now to his clients, and has been doing that. So the plans cannot say that they are insurance. It is co-insurance, and it functions like insurance, but we're not allowed to say that it's insurance. So that would be the first thing to remember when you're sharing about the healthcare plans. You notice I'm not saying health insurance plans. I'm not saying health insurance. I'm saying health care or health coverage or health plans, health benefits, things like that are okay to say. And you also do not want to be an expert. So although I told you to go to the website and learn, you want to be a referral person, just like with the DAC loans. With those loans, we're not loan agents, but a licensed loan agent can be contacted, and all you are is a connector. Just think of yourself as a connector. So every time you go into a small business or any friend that you meet, you can ask the question, hey, what do you do for health coverage? And I've been doing this week, and it's really been amazing to get the responses, because people will open up to you and start telling you what they don't like about their plan, and which one they have, and what their deductible is, and how their premiums are really high, and all kinds of complaints that seem to come out. So that you're here to serve them. This is one more arrow in your longevity quiver, to be able to help them save money and get better coverage. And there's some very unique differences between this and traditional plans that are out there. The first thing is that there's no deductibles. And you've probably all heard this if you've been around for a little while. That is our biggest difference, no deductibles. So it really has been an issue that bothers us as being self-employed and looking out there and trying to get a plan, because if you don't have an employer that puts you under their group, then you have to go find a plan on your own. And they're usually very costly for the monthly premiums. $1,500 to $2,500 a month, a family is typical for someone who's not part of an employer that's helping defray that cost. And then on top of that, to add insult to injury, then they have a deductible that they have to meet. It's usually high, $5,000. It can go up to $16,000. So you're out of pocket all that money before you get any benefits. It's as if you didn't have any insurance at all, because most people make an average claim of under $8,000 a year. That's what they found in the industry. So it's likely that you're not even going to need it. And think of all the money, hundreds and hundreds of thousands that you're putting into it that you never get to see. So something that's very unique here is no deductibles. We have first dollar coverage, which means that because there's no deductible, when you want to use your plan, you can immediately pay a 50% co-insurance of the already reduced rate. The rate is already pre-reduced through the PPO, which is backed by Aetna. So everyone's heard of Aetna, right? And that's a really popular network. So they have already done between 30 to 60% reduction of the cost. And then you have co-insurance, because we are joining a co-op. Our co-op is DAC. DAC enables us to be part of that group. Because remember I said, if you don't have insurance, you are in the open market. You have to be part of a group, and our group is DAC. So they pay the co-op membership per year, which is only $24 that they pay. It's $2 a month. And then we can enjoy the benefits of being part of that group. So here's an example how it would work. If you had one of our plans, and there's 4 to choose from, and this is the same if you were an employer group or you're an individual that joins through DAC or longevity. So let's say you went to the doctor or the hospital or whatever your procedure was. The first thing is you have one of our plans, so you have an ID card, and you make sure that that provider is in the network first. You don't just go anywhere. You have to make sure, which is typical for any coverage plan. You have to make sure your doctors are part of it. And there's 4,000 doctors and hospitals and urgent cares that are part of this network. So it's very, very big. So chances are your doctor will be in there, and if not, there's a process if they would like to be added, that they can click on the add link and they can be added. So let's say you go and the bill is $1,000, for example, and you have one of our plans. The sticker price of the bill before you show them your plan. So they look up in the computer, okay, Aetna, PPO, and your rate is now 30 to 60% off. So let's say it's 50% for easy math. So the bill would be $500 because of your coverage that you have. And then the co-insurance kicks in after that. So you pay 50% of the $500 and the insurance pays the other 50%. Co-insurance. So your bill is $250. And then you don't pay that right then. When you're at the facility, you get a bill in the mail a few weeks later. You send off your money for $250, and it shows that you were covered by your co-op plan for the other $250. So 1,000 went down to $250, and you get that reduction before, because there's no deductible to have to meet. So that's what first dollar coverage means. Right away, you get to have the benefit. So that's a huge savings. And the four different plans have a price range of $285 a month. We don't say it's a premium because that's health insurance and we're not licensed agents, so we can't talk about premiums. That is to say, it's a monthly fee you pay. And $285 would be for an individual, and then it goes all the way up to the highest plan if you had a family plan, $955 a month. So it's still far less than the industry average for covering as many people in your family as you have. So the plans you can read about and compare on the site. And one thing you'll see is it'll say the member annual out-of-pocket maximum. So for plan, the very base plan, plan A, if you had it for the family, it would be $425 a month, and then it would cover $7,500 of the, we'll say, wholesale cost. So if you typically have the bill is already pre-reduced about 50%, then that's really $15,000 of coverage of sticker price. Does that make sense? So it's showing you on the website, and you can download the brochures here so that you can actually show someone something in paper. And then it goes up to the highest, which would be Plan D. And Scott and I have had Plan D for our family. We chose that because we have 3 kids that are active, a teenager and a 20-year-old, and love to snow ski and do things like that. So we wanted to make sure we were covered. So that's why we picked Plan D, but it's personal choice. And the total coverage, there's an additional amount that goes all the way up to $200,000. But remember, that's really $400,000. So that's a big, big amount. Hopefully we won't need to use that, but if something happened, that gives us the peace of mind. But our annual maximum is not half of that. It's $14,000. So that's written on there as well. So there's quite a few things to learn, and remember that you don't want to be coming across as if someone says, well, I have this or that ailment, what's covered? That is for the insurance agent to look into. So you don't do those kind of questions. Remember, we're just connecting them. So they can click a button that says, contact us, and they can get those questions answered from the team of professionals that's with the Freedom group. It's called. So these are called the Freedom plans. Now, how much do you get paid? You might be wondering. If you wanted, first of all, can you sign up your next door neighbor who doesn't have insurance, that is not a business owner? Does anyone know the answer? Can they go straight onto your website, your replicated website, if they're your next door neighbor and they're not an employer group and they're not in longevity? No. They can do it, but they have to do one thing first. They have to become part of longevity or DAC. So that's the first thing. So how do they do that and get linked to you? So that's davidallencapital.com/your username or ID number. And they go to the bottom of the page and they click partner with us. And then they are becoming representative of David Allen Capital. They're becoming an agent. And we have to do this because it's important, because we're not licensed agents. We cannot make commissions on health plans unless it's done this way. And so we're the only company that's able to offer this, and it's amazing because so many people in network marketing don't have any coverage. It's too expensive, it's priced out of the market, they just cross their fingers and say, well, I'm healthy, I'm taking my nutrition. However, accidents happen, things happen, and really it's inevitable. Something's going to happen, right, Claire? At some point, something's going to happen to you or one of your loved ones. So it's great to have some kind of coverage. Now, how much will you make? So if you sign up your next door neighbor into longevity or DAC, it's interchangeable. The ID number they get works with both. Then now they have an ID number immediately that comes up, and then they can sign up under you for the healthcare by going to the site that I just told you, only will be / their new ID number. So now it's linked to you. So you're going to get paid commission on it. And it's a little different than if you had signed up someone and they bought a product, because that goes on your first level. And this is considered a personal volume. So it helps the personal volume qualifications that we all need every month. And
Can we
the
take a
volume
break?
is what?
1 second. I just need to plug this in and I need to switch it over. So I don't want the computer to die while you're in the middle of your talk. And it's getting pretty low. So hang on a second here. I'm starting to sweat like in True Lies.
I don't want to stress you out.
Do you have a
Maria.
joke like
Tell a joke really quick.
I've heard so many good jokes and then they just
I cannot.
fly out of my head. And I have to pre-plan that.
I know.
I'm not like Tom who can just.
We bring up James. Do you have another joke, James?
Oh, there we go. All right, we're up.
We're back on. Okay.
Become an
Okay.
DAC agent. How much is the minimum? $35? To
For
become a DAC agent, all longevity.
to become a DAC agent is free. Yeah, so they can become a DAC agent, and all it is just putting in their name, address. They do have to put their social security number in because they're signing up as a
So
representative.
they can go through our site, /ID.
Right, so let's say you wanted to sign up a friend or a patient at your clinic, Dr. K, and they are not a part of your team in longevity, and they would like to get health care, and they're not an employer, because if they're an employer, I'll talk about that separately. So they would go to davidallencapital.com/Dr. K, whatever your ID number is. Go to the bottom of the page and click partner with us. They sign up. They immediately are given a screen that says, thank you for becoming an agent. Here is your ID number. Or they can do this through longevity if they want to be part of longevity. Either way is great. And then now they have that ID number. Now you help them, show them, they go to dachealthcare.com/ their new ID number. And they can pick whatever plan they want. They click enroll now. If they have questions first, they can call the number that's for contact us and have the licensed agent answer the question. And then they sign up and longevity knows to pay you on their plan. So for the individual plans, it's 75 QB a month and 60 BV a month. And then for the family plans, no matter what one they get, A through D, 100 QB, 75 BB. So you would make, Dr. K would make on the new person that bought a individual plan, $4.80 a month from DAC. It would be added to his longevity bonus check. And then if they got the family plan, then he would make $6 a month. And that might not seem like a lot, but in insurance, that adds up and that's a lot, correct? Those of you who are in the room, yes, they're nodding their heads. So here's an example. Let's say you sign up a representative that goes out and signs up 100 people over time with a plan. Then let's say it was an average of, some of them were family and some of them were individual plans. So the average would be $15. So it's $12 or 16, let's just say 15. So the representative that signed up those 100 people is going to make $1,500 a month ongoing. And you are going to make money in the structure. So they're going to make that money directly, and you're going to make 500 on that. Just that one person who has 100 people under them. And so that's 8%, and then the person above you, your sponsor, is also going to make 8%, as long as there's a qualified sales associate. It keeps, and then 7% on the third level. And that's in the pay plan, which is another topic. So really, this can be a way to really stabilize the volume that you need for your qualifications. Yes, Claire's saying absolutely, because people do not like to drop their plans. And if they did drop their plan, then they cannot get back onto another plan for, well, we don't go with open enrollment or anything. It's completely outside of that. But they have to wait a year before they can sign up for another plan if they drop.
Through DAC.
Through our healthcare, right? So that's a good point. We don't fall under open enrollment. So right now it's open enrollment for the insurance world. People are making changes. This is a really good time to bring up the question.
Like December 15th.
Yes, yes.
Mhm.
What do you do for healthcare? And I just called a friend of mine and said, what do you do for healthcare? Oh, we have MediShare. And she said, well, let me tell you why I don't like it. And I didn't even have to say anything. She just told me all the reasons. She said, it's expensive, and I have a high deductible, and she said I have to get a lot of mammograms because she's had a cyst before, and she said it's really expensive. So with ours, all the wellness is covered. So we are compliant with the ACA, which is Affordable Care Act. And so this counts on your taxes as coverage that counts, even though it's not a typical insurance. So that's reassuring. And we have wellness covered. So you can go and get mammograms and colonoscopies and pap smears and all of those physical once a year, and it's all completely covered. You can see your doctor 3 times for the primary care doctor, and it's $20 per visit. So that's really good too. And then I only have a couple of minutes, but there's a whole different incentive for employer groups. And if you, we've been meeting with real estate offices this week and last week and the week before, explaining to them, because a lot of times their agents have no health insurance coverage. And this is the only plan where the employer can pay none, half, or all of the employee's bill every month. So the employer could say, okay, the agents are going to pay their own because there's hundreds of them and they're all independent. And then my office secretary that answers the phone, I want to pay for her plan so he can set it up that way. And you don't have to get into the details. You can click sign up a group and they will help you do all that. So it's really nice.
Okay, so I have a question.
Yes.
So you're saying, so 100 people on an individual plan, so that's 60 BV times 100 is 6,000, you get paid 8%. If you personally enroll those 100 people, right? So that's 400.
No, you don't get paid the 8% because it's like a retail.
You do get, that's what I'm saying.
Yeah.
You do get paid the 8%.
You get paid the $6 on the family plan, but not the 8%. The 8% is what your sponsor makes because of you having all those 100 people. Because you can't double dip. The way DAC does it is different than the longevity pay plan because the customers or the people that you sign up with plans are considered a retail sale. So.
But you'd make 600 off of that scenario because you get $6 per month.
Right, you'd make 600, and then your upline would make the 8% on the volume. So,
So if you had an insurance agent who licensed plan and they did the 100 and I'm the sponsor, then I get the 8%.
right,
Okay, go ahead.
but you don't get QB on your, or you don't get paid on your own. And the retail people, if you sign someone up, they're considered retail on your level 0 on the pay plan. Yeah.
So tell me again, $400, what is it, 4?
It's $480 a month
And then 6.
for each member on the individual and $6
On the van.
Yeah. So that I know my time's out, but I wanted to share just one thing about the claim funding. And if you're not into insurance, you're going, what the heck is that? So what that is with any plan, there's part of it goes to administrative costs, which they're calling fixed cost. And then the other part goes to a pool. It's called claim funding. And an employer, if his employees don't use all of their claim funding every year, then he gets or she gets a check back at the end of the year for the difference. So it can be hundreds or thousands of dollars that the employer gets back. So that's a huge benefit that I've never heard of before in this industry. And it's because we're part of a co-op. So you know, like REI, if you go to shop at REI, at the end of the year, they give you a check back. And that's because you're in a co-op and the members have to benefit. So that we're members, we benefit from people being healthy. So there's your foot in the door to talk about 90 for life. Because you want them to be healthy so that the employer can get their money back and share that with the members. So then he could say, okay, I'm going to reduce your rate next year. And you know, maybe you want to bump up your plan if you're interested in getting a higher plan. And I'll pay that difference because he's got this extra money to spend on his team, which is really cool. And so the other thing is when you're telling people about the plans, they're going to say, oh, I have this situation, I'm diabetic, I have Crohn's, whatever they have. And that's another way that we can share Dr. Wallach's message in our products because they've just told you all about their health. And you can help them with their insurance, their co-insurance, their health plan, and you can help them prevent or reverse whatever their issue is. Not that we're making any product claims, but we all know how powerful our products are and all the stories and testimonies that we have. So I hope that was demystified. If not, if it was confusing, then please see me afterwards. Yes.
One quick question. When you send that link to your replicated health plan site, comes up employer info and then DAC, YGY agent. You click through that and it looks like the sign up is self-populated with your member number and that they can continue on through that and sign up. Can you go back? I mean, will they get a member number through that, or do you have to still get them a member number and go back in?
So if they're clicking on the DAC YGY plan, they're not an employer, it's going to put in an account that's not your number. It's like the DAC home number. And that's because, like I was explaining, they have to be part of DAC before they can click on that. And then if they click on the employer side, it will say Robert Estes and your ID number, and you will get credit for that, and that will give your retail sale like the same. Because they have to join the co-op. The employer is going to pay the $24 a year, and they have to have a minimum of 2 employees to be able to do that. So if you just send someone your site, you're right. They cannot sign up without first becoming an agent of DAC or longevity, and then going back. So you have to help them with that. But sending them the site is great if it's an employer. Otherwise, it's a great place for them to read all of this stuff, like print out, things like that, or request a quote or get help. So one more thing that I'm excited about that longevity has provided for us, help us with what Scott says is the other side of the coin with health, which is the reactive side, and proactive side being products. So, all right. Thank you so much for listening. Thank you for listening online. Tom, we loved your talk. You jazzed us all up if you're still listening. And Nikki and Joel did such a great job too, just talking about putting our belief into action. So if we get all this head knowledge and then we just sit on it, it makes no impact, right? We all know that. So go out there and look at your phone for starters and say, who do I know that I can call and have a conversation with? And then do it this week. How many people are you going to call this week? That's what I think the takeaway needs to be. Just, that's right. So thank you so much. I'm glad to be here.